First Delta, now the Mu variant. And are doctors on the front lines worried about seeing a post-Labor Day COVID spike? Dr. Nicholas Testa is the Chief Medical Officer with Dignity Health Southern California, and he joins us now. Good morning to you, Dr. Testa. I hope you are well. It's good to see you.
Good to see you, too.
So every day we hear more about the Mu variant, which the World Health Organization has called a variant of interest. But while some public health officials say it should be on our radar, they also say the focus should remain on the Delta strain. What are your thoughts? Should we be concerned?
So the Mu variant is the fifth variant of interest. And a variant of interest is any variant that has the genetic indication that it could be more transmissible. That doesn't mean we've seen it become more transmissible. We just watch it very closely. By far and large, the Delta variant is still the primary variant that we're seeing across the United States. So the Mu variant stays is something that we watch closely, but right now it's just a variant of interest.
Got it. Okay. So lots of people gathered with family and friends over the long Labor Day weekend. Are you expecting to see a spike or surge, and when would that show up if there was one?
Based on historical trends, we see the biggest spikes right after large holidays when people get together. And so, with Labor Day having been just last week, we usually anticipate it to be somewhere between 10 to 14 days afterwards. So I anticipate the same thing in our hospitals in Los Angeles, where we'll see a bump up in hospitalizations probably towards middle to end of next week.
Okay. Now, it is less common for cases of vaccinated people getting COVID. How long does someone have immunity once they get COVID? And do they have immunity? I know we talked about that, but there was some question.
So they definitely have a heightened immunity after the vaccination. What we're seeing, there was some literature that was just published last month that shows that immunity starts to wane at about 8 months. And that's why we're seeing a push for boosters or third doses for the mRNA vaccines for the immunocompromised population. I would anticipate come end of summer, early fall, we'll see a recommendation from the CDC around boosters for the rest of the population.
Okay. Dr. Nicholas Testa, Chief Medical Officer with Dignity Health Southern California. Thanks again for joining us this morning.
Thank you.